All right, well, it is 6:30, so we're going to go ahead and get started. Welcome, everybody, to tonight's program, High Blood Pressure, a Silent Killer. My name is Beth. I am the Adult Program Manager for the Mid-Continent Public Library, and we are joined this evening by Christy Kavanaugh, the Cardiac Program Manager with the North Kansas City Hospital. So welcome, everybody. A couple of housekeeping items before we get started this evening. We are going to record tonight's program, and I will send out the link to the recording once it is available on YouTube to our registrants. I will also send you an email after the program with the slides from tonight's program. If you have questions, we are going to ask that you type them in the chat, and we will save time at the end for questions. That way we can ensure that we have a good recording of the program. I have gone ahead and put the link to tonight's survey in the chat. So if you can take a moment at the end of the program and give us your feedback, that helps us to know what kinds of programs people are interested in and to continue to get funding for programs like these. And I'm going to also mention a couple of upcoming programs here. And the first program I wanted to mention, we have a historian, Tom Emery, who will be coming into town from Illinois on September 24th and 25th. And he will be at our 4 branches, the Midwest Genealogy Center, Redbridge, Woodneath, and Smithville, doing a program about the Civilian Conservation Corps in Missouri. This was a hallmark New Deal program during the Great Depression and considered one of the most successful government programs in American history when it came to putting people to work. So that should be an interesting program. That one is in person, but you can register for the location that you want to attend at. The second program, Exploring Western Provence, is a Zoom program. Gene Flynn is back with another in his Armchair Travel series. This time we'll be exploring Western Provence, so think middle-aged towns and Roman ruins, as well as wine and lavender fields. He'll be sharing the over 150 years of history that continues to draw artists and tourists to this region of France. That one you do need to register to receive the Zoom link, and it is on October 8th at 7 p.m. Then, as we all know, open enrollment season is coming up. On October 9th at 3:30, we will be joined by Taylor Gardner for our Medicare Education Seminar. This is in person at our Grandview branch as well as on Zoom. You do need to register to receive the link if you want to attend on Zoom. But he'll be discussing the 2024-2025 Medicare changes and the differences between the Part C, Part D, and Medicare supplement plans. He will also be doing this program in person at several other of our branch locations, and you can find those in our calendar of events. On October 15th at 6:30, friends from North Kansas City Hospital will be back. Registered dietitian Lindsay Moore is going to bust through some common food and nutrition myths and help us to explore ways to have a better relationship with food and reject the diet mentality. And that one is at 6:30. And then finally, on October 17th at 6:30, Our friends from the University of Missouri Extension will be taking a look at gluten-free eating, whether it's for allergy reasons or diets, but they'll be talking about different popular gluten-free products as well as some tips for alternating your favorite recipes. So I'm going to stop sharing my screen so that I can turn it over to Christy and let her get started with tonight's program.
All right. Good night or good evening, everybody. My name is Christy Kavanaugh. I'm the cardiac program manager here at North Kansas City Hospital. You guys can see my slide.
We can see your slides.
Okay, perfect. All right, well, I'll go ahead and get started. We're talking about high blood pressure tonight, and it has been labeled the silent killer. So we'll go ahead and talk about why it's gotten that label. Okay, so just start with some of the prevalence of high blood pressure. It is currently and has been for a while the most common primary diagnosis in the United States. It attributes to 35 million office visits. More than 50 million American adults have high blood pressure. So they say that's nearly about half of all American adults have it, and many of them don't even know that they have it. They say about 1 billion people worldwide are affected by high blood pressure, and it attributes to 7.1 million deaths per year. And the only way to find out that you have it, you can't just tell usually by looking at somebody, is to have your blood pressure measured. And then for proper diagnosis, it's important to use an average based on 2 or more readings obtained on 2 or more occasions. So your healthcare provider or local pharmacist can check it for you. And I have gotten permission. I was telling Beth before we got started that I'll kind of tell a little bit about my husband's journey through having high blood pressure. And he is definitely somebody that you would look at and not think that he has high blood pressure. He's not overweight. He doesn't smoke, doesn't really drink a lot. So we were very shocked when he came into the hospital for kind of a routine test, and they said he had high blood pressure. And so again, that was just the first reading. So then we checked it again and it was high again. And so I'll just kind of weave his story in here a little bit because he's a little bit entertaining guy. And then, of course, the definition, just real basic. Blood pressure is the force of blood pushing against your arteries. And it's documented as 2 numbers. The systolic is the top number and the diastolic is the bottom number. So the systolic number, that top number, is the pressure when your heart is beating or pushing the blood out of your heart into your blood vessels. And then the lower number, the diastolic blood pressure, comes from when the heart is at rest. So the pressure in your vessels when the heart is at rest. And then it's really important to know your numbers. So normal blood pressure is considered that systolic number under 120, and then the diastolic less than 80. And of course, we get into a little bit too, we don't want those numbers too low. So usually it doesn't show it on this screen, but usually you don't want your top number to be less than 90. So the top number would be a range between 90 and 120. And then the lower number, it can be as low as 50. So 50 to 80 is a good range for the diastolic. And then once you get up into the 120 to 129, we just call that a little bit elevated. It's just something to watch. And then again, if you're a little bit over 80, you would fall into that elevated. And then stage 1 would be if you're getting above 130. So like 130 to 140 would be considered stage 1. Stage 2, anything above 140 on that top number. and then the bottom number above 90. And then you would be considered in a hypertensive crisis if your systolic number is over 180 and your diastolic is over 120. So again, just to weave my husband in, he was kind of up in this range. And I was just like, that can't be right. That has to be, you guys have probably heard of the white coat syndrome. So I was like, it has to just be because he's here at the hospital. He's, you know, always healthy, never comes to the hospital. He's just got this white coat syndrome. So I was like, that can't be right. So we took it at home. It was a little bit better than that when we were at home, but it was still kind of between stage 1 and stage 2. So then the way that you measure it, there are a couple different options for the blood pressure cuffs. The most traditional is the upper arm cuff, but they have come out with a lot of wrist cuffs, and we did buy a wrist one to use at home on him. And again, like I would test it on me to make sure it was reading right. And I was like, well, that seems right for mine, so it must be right on you too. And then when you are measuring your blood pressure, they say to avoid caffeine for and exercise and smoking for about 30 minutes prior to um, measuring it. And then make sure that your cuff is appropriately sized too. So on the wrist, it's not as important, but the arm cuffs, the upper arm cuffs, you can get in the standard size or large, and then they also have a small size too. And then you want to keep records of it. So it's important to keep a log. And this is just an example of one of the logs that we've created here and hand out. I think it's in some of our patient education books that get sent home with patients. And then check your blood pressure about the same time every day. Typically in the morning is best. And then again, here's just some pictures of the examples of the blood pressure cuff. So the standard one on the arm there. And then if you have the wrist one, they say to use it on your left wrist. And then also to have the screen on the same side. Actually, there's a lot of different wrist ones. So they kind of all have instructions on how to use them. But then also having your arm kind of bent up like that where the screen is at the heart level is the way most of those wrist ones work. So again, just if you have any questions as I'm going along, type them in the chat. And Beth will either stop me or we'll do them at the end. And then this little picture shows a good way to be sitting and has some tips for making sure you're getting an accurate blood pressure reading. So again, you can, validate your monitor. A lot of pharmacies, you can take them in, they'll check them against theirs. Or you can take it to your doctor's office and make sure it matches up with the reading that they're getting. And again, it says for 30 minutes before, don't drink alcohol, caffeine, exercise, smoke, and then also empty your bladder. And then just to kind of sit quietly in the chair for about 5 minutes before you take it. And then right before, make sure the cuff is the right size for you and wrap the cuff against your skin just above the bend in your elbow. And you want it to fit fairly snug. And then while you're taking the blood pressure, be sure not to talk. Don't cross your legs. Try to relax. Sit upright with your back straight and supported. And then afterwards, if you're checking it at home, wait 1 minute and then take a second reading just to make sure they're pretty close. And then if they're not real close, maybe take a third one and just kind of, they say just an average of the best two to see where you're at. And then talking about the types of high blood pressure. So 95% of the cases, it's just primary high blood pressure, and there's really no established cause. And you really can't tell, like I said, can't tell by looking at people that they have high blood pressure. And then secondary high blood pressure, it's really less common. It's only about 5%. So it's secondary to other causes, maybe kidney disease or liver disease or medications that you're on can cause that secondary high blood pressure. And then there are some risk factors that can be controlled. So we'll kind of get into these a little bit more, but poor eating habits, cigarette smoking, obesity, physical inactivity, high cholesterol, and diabetes can all contribute to having high blood pressure. And then the screen kind of talks about the same thing. So what can raise your blood pressure? So specifically a high salt diet can raise your blood pressure. Alcohol, drugs, especially like a lot of the methamphetamine and speed type drugs will really bring people in hypertensive crisis. Caffeine though also, so just coffee and a lot of the energy drinks can really raise blood pressure too. And then obesity and stress is one that we haven't talked about a lot. And I would say with my husband, that's the only thing really is it's not so much that he has a lot of stress in his life, but he gets stressed about stuff. He gets upset or, worked up about stuff that he shouldn't be making him so worked up. So I have to tell him a lot of times, you're making your blood pressure high. You just need to relax. And then the ones, of course, that are difficult to control as we age, and then also being a man, that men are more likely to have high blood pressure. And then as they get older, than 55, and then race and ethnicity can also, in the African American population, we do see more high blood pressure in that race. And then women, we don't tend to start getting high blood pressure until we're over 65. And then again, I already said the gender, higher in males. People that have sleep apnea, and a lot of times again, it's more prevalent in men to have sleep apnea. And people that are overweight will have sleep apnea. With the thick necks or short necks are more likely to have that sleep apnea. And then any family history too, which you can't control, of premature cardiovascular disease. So if you've had a father or a grandfather that had a heart attack under the age of 55, or a mom or a grandma or sister that's had a heart attack under the age of 65, then that puts you at a little bit higher risk. And then kidney disease also will put you at high risk for having high blood pressure. And then these are just some complications of prolonged uncontrolled hypertension. So it can hurt your body in many ways. It adds to the workload of your heart and damages your arteries and organs, such as your brain, kidneys, heart, and eyes over time. And the effects of high blood pressure can be prevented or reduced if it's treated early and kept under control. So my husband did get put on a high blood pressure medication, and then I remind him to not get so worked up about stuff every once in a while. So then again, these are just kind of the targeted organs. Of course, it can affect your heart and cause heart disease. And so there is a test that you can have done here at North Kansas City Hospital, and I'm sure they do it at other hospitals. It's called a heart calcium score, and it's just a CT of your heart and your arteries and your cardiac arteries. And he came back with a little bit elevated on the calcium score. And so that meant that high blood pressure was already starting to affect his cardiac arteries. And he has the beginnings of coronary artery disease. So he got put on a statin too for that, because we found out he had high cholesterol too. And then of course, the next thing that high blood pressure is going to affect is your kidneys. It can also affect your nervous system, so your brain and your muscles and stuff throughout your body. And then it'll affect your eyes too. And then our treatment goals would be so again, you want to get down into that normal target range. So you want your systolic less than 130, and your diastolic less than 180. So that would be your goal, to attain that systolic blood pressure goal, and that will help reduce cardiovascular, renal morbidity, and mortality. So even small changes can make a big difference. So you can manage your blood pressure and keep it in check by not smoking, vaping, or using tobacco products, eating a heart-healthy diet, reaching and maintaining a healthy weight, getting regular physical activity, limiting your sodium or your salt intake, limiting your alcohol intake, and taking your medications properly. I think we've got a slide coming up. Yeah, this one shows, so even a 10 millimeters, so that when we measure blood pressure, it's measured in millimeters of mercury. So a 10 millimeter reduction. So if you're at 140 and you can bring it down to 130, then that shows that it can significantly reduce several conditions. So your coronary heart disease can be reduced by 17%. Your risk of having a stroke can be reduced by 27%, and your risk of going into heart failure can be reduced by 28%. So like we said on that slide before, just some of those small changes, if you can just bring it down just a little bit, can greatly improve your overall risk factors. And then these again talk about the lifestyle modifications. So weight reduction, if you can maintain a normal body weight, so the BMI normal is between 18.5 and 24.9. So anything less than 25 on your BMI can be an approximate 5 to 20 reduction in your systolic blood pressure. Adopting a DASH eating plan. So DASH stands for Dietary Approaches to Stop Hypertension. And it's really just a diet that's rich in fruits and vegetables, low-fat dairy products, with a reduced content of saturated and total fats. And again, that can, by adopting that diet, or at least, trying to do it 80 to 90% of the time, can help you reduce your systolic blood pressure by 8 to 14 millimeters of mercury. And then the dietary sodium reduction. So reducing your dietary sodium intake to no more than, 2.4 grams of sodium, between 2.4 to 6 grams of sodium can again reduce that systolic blood pressure. And then engaging in regular aerobic physical activity. Really, the best thing we recommend is just brisk walking at least 30 minutes per day, most days of the week. You can get between a 4 and 9 millimeter reduction in your systolic. And then moderating your alcohol consumption. So limiting consumption to no more than 2 drinks. So either 2 beers, or 10 ounces of wine is considered 2 glasses of wine, or 3 ounces of any hard liquor per day in most men, and no more than 1 drink, not fair, right, in women and in lighter weight persons. Then you can get a small reduction. So really the biggest one, is staying at your normal body weight and managing your diet. It's going to get you the most reduction in that blood pressure. So then it's just kind of lists them out in a little bit more simple text. So decrease time sedentary or sitting, which will increase your physical activity, decrease meal and snack portion sizes, and also reduce calorie containing beverages. So sodas mostly, and alcoholic beverages. And then for adult follow-up, if you have a normal initial blood pressure reading, then the recommended follow-up is just to recheck it in 2 years. If you're pre-hypertensive, which would be anything like 130 to 140 on the top number, recheck it in 1 year. Stage 1 hypertension, you'd want to recheck it again within 2 months, probably sooner. And then stage 2 hypertension. So we went back to, let me go back to that slide real quick that has the stages on it. Okay, so stage 2, yeah. So anything above 140 on the top number or 90, then you're going to want to probably be checking in with your doctor right away about that. And of course, then if you're up here, they might be saying, if you call your doctor and say, my blood pressure's 200 over 120, they're probably going to say, you need to go to the emergency room. Okay, sorry, let's come back to that slide. I think we're doing good on time though. Okay, yeah. So stage 2, evaluate or refer within 1 month. For those with higher pressures, so the 180, greater than 180 over 110, evaluate and treat immediately or within 1 week, depending on clinical situation and complications. So sometimes when that blood pressure gets up real high, you might not be feeling right. Some people will get kind of diaphoretic or sweaty when their blood pressure gets high. They'll get lightheaded, they might get nauseous, but then there'll be other people that don't even have any idea that their blood pressure is that high. And then free blood pressure checks. So North Kansas City Community Health does check blood pressures every Wednesday at Gladstone Community Center. And then we have sometimes too at a lot of the library locations. I know that we go to Liberty Community Center also, and some of the farmers markets. We were hitting a lot of those throughout the summer, and we've got some in the fall too. So you can't always check it's just nkch.org website, and they have a listing of all the upcoming outreach classes and what we call biometric screenings, which you can get your blood pressure checked, also your blood glucose to see if you're in range for that too, because if your blood glucose is high, then that can be a sign of being diabetic. And then we also do the lipid panels too, so we can check cholesterol levels and stuff for you at some of those events. Not all of them, but all of them we definitely can check the blood pressure at. And then also most local pharmacies have free blood pressure machines that you can take. And the blood pressure machines have gotten very affordable, the home ones that you can buy. I think that the one we got for my husband was maybe $20 that we got it off of Amazon, but you can find them at any pharmacy. Walmart has them, CVS, Walgreens, and they've gotten a lot better than what they used to be and a lot more affordable too. And then, so this is just kind of a little checklist that we got off of the American Heart Association website. And they also have some good, you can go on to their website too and print off the blood pressure logs to keep track of your blood pressure. So then this just kind of tells you what you should do based on, well, it's kind of a questionnaire about how often do you check it. So if you're in that stage 1 or stage 2 range, you should probably be checking it every day. If you're just in the pre-hypertensive, like the 120 to 130 stage, you might want to check it about once a week. And then if you're normal and you're checking it at home, you have the ability to check at home, then you might as well check it every month. And then this was just kind of, if you check it, do you keep a log? Yes, you should keep a log. And then are you taking your medications as prescribed? Of course, that will help with your blood pressure. And then this just talks about any challenges that they might, that your doctor or social worker or community outreach can help with. So to get less salt in my diet, I'd like to, and you can say which ones you want to do. And then it's hard for me to manage my blood pressure because, and this is true, a lot of times that patients don't like how the blood pressure medicine makes them feel. So these are all kind of a checklist of things you can talk to with your doctor about. And then during my appointment, I'd like to discuss all these things. This way you just can stay on track when you're at your doctor's appointment. And of course, to be prepared you'd want to bring a complete list of your medications so that you can talk to them with your doctor, and a pen and paper to take notes. And then you can write down your blood pressure and say if it's normal, elevated, stage 1, or stage 2.
Thank you, Christy, for a very informative program and lots of valuable information, as we see in the comments here. And thank you, everybody, for joining us this evening. I will send out the link to the video once it is available on our YouTube channel. If you missed part of the program or want to go back and review information or share it with others, it will be there for you. And have a great evening, and thanks for coming.
Thank you.